All right, we're live. Good morning, good afternoon, good evening, depending on when you're watching this live. This is the voice and face of Dr. Olabintan, CEO, founder of Livingspring Family Medical Center, where we believe that the quality of life is just as important as the quantity of life. We help our patients live long and well. And I'm excited to be here today with the one and only Dr. Joya Sykes. Yay! Um, Dr. Joya Sykes is a family physician and a wound specialist here in the good city of Mansfield, Texas. And so we're going to be doing a live with her discussing the question, Doc, I get wounds a lot. How do I treat them? Dr. Joya, thank you so much for joining us today. How are you?
Absolutely. Doing well. Thank you for having me.
All right, awesome, awesome, awesome. All right, so first question, please kindly introduce yourself, who you are, and what do you do?
Absolutely. So I am Dr. Joya Sykes. I'm originally from Ohio, but I came to the great state of Texas to get away from the winters. We love the winters here. They're very short-lived. But I attended Ohio University College of Osteopathic Medicine. So I'm a CEO, a doctor of osteopathy. I'm board certified in family medicine. Learned about wound care while I was in my residency and loved it and decided to continue doing it after I graduated.
Awesome, awesome, awesome. So, curious minds want to know why do you do what you do? Why wound care? What I know you
Yes,
touched on it a little bit.
so that's a very good question. Wound care is very gratifying. Patients come in with these huge wounds. They're very concerned. They're in pain. They want to know how to heal them because most of those wounds are chronic, so they've had them for months and months. So once we get in there and we're able to see the etiology or the cause of the wound and find out ways to use products to help those wounds to heal, those patients are so grateful. We build a relationship with our patients. They tend to miss us when they have to leave because their wounds are healed. It's a really gratifying career to allow them to come in. They're concerned, and then they leave so happy because their wounds are healed.
Okay, you make people happy because their wounds are healed. You
Yes.
help heal their wounds faster. Okay, awesome, awesome. Now, real quick, I was going to ask, the first question is this: who are those at risk for having wounds? Typically, like who are the patients you typically see that have a lot of wounds or recurrent wound infections?
So all patients are pretty much at risk of developing wounds, especially if they are not regular goers to the primary care physician. So sometimes they don't even know that they have other underlying conditions like diabetes or vascular abnormalities. So smokers are at risk of developing problems with their circulation. So that is a place where wounds can develop. Patients who are obese may have some lymphedema, their lymph system is being blocked, and the lymph that's produced is able to go where it needs to go. So that breaks down the tissue and allows wounds to develop. Diabetics, of course, patients who are diabetic with neuropathy and they can't feel, have feeling at the bottom of the on a glass jar, and they don't even know, and then eventually that gets infected and it develops a huge wound. Um, let's see, patients with venous abnormalities like venous, we call it venous insufficiency, where their veins are not pumping the blood right to their body. It allows fluid to just flow to the lower extremities and allows that break down the tissues.
Okay. So you mentioned like we're having a hard time hearing you a little bit, but we're going to make this work. So people are at risk for wounds. Generally speaking, people are generally at risk for it, but there's some patients who tend to be at higher risk. Those who have diabetes, loss of sensation or what we call neuropathy, so nerve changes, where they're not able to feel or notice that their feet are starting to have cuts, and those cuts can get infected. We talked about those who are smokers, those who are obese as well, those who with lymphedema, and those with venous insufficiency. So a lot of people are at risk, but there's some people who tend to have more of a risk. So that's something to watch out for. Next question: how can one prevent them? one would guess that not having those things, but how could are there things even with those things one can do to prevent the risk of wounds?
Yeah, so absolutely. So exercise helps bring that fluid back from the lower extremities to the center of the body to prevent that fluid from just pooling at the lower extremities, allowing that tissue to break down. So exercise. Diabetics who may have neuropathy, make sure you're following up with your primary care physician frequently. Daily, check your feet, make sure there's no wounds or any scratches or anything on your feet that could potentially lead to a wound. Patients with venous disease, wear compression hose. Keep that fluid out of those extremities that can break down that tissue and cause the wounds. People who are smokers, I know it's easier to say than to do, but don't smoke. Stop smoking. That will help. And again, seeing your primary care physician regularly so you can determine your risk factors and things by the things I said.
Okay, compression stockings, very good. For the venous, and then you mentioned exercise. I didn't tell her to say this. I didn't, exercise helps a lot of things.
It's very important.
Exercise is a lot. Is it comes up in so many conversations. Exercise definitely helps reduce the risk of wounds. All right. So quick at home tips for cleaning a wound.
Yes.
Someone has a wound. Quick at home tips. What would you say?
So basic soap and water. Soap and warm water. You do not use peroxide. I know that is an old wise tale that we trees, but peroxide does not help wounds heal. Actually, our body naturally has healing factors in our bloodstream system, so it sends those healing factors to the wound anytime you develop a wound. I put peroxide on those wounds, kills those cells that we need. So just normal soap, warm water.
It's so interesting, that sometimes, if it doesn't burn, it's not working.
Yes. No, that is not the case. Although soap may burn a little, but you don't need it to burn to know that it's doing.
To avoid hydrogen
peroxide. Yes.
Oh my goodness. Avoid it. Good old soap and water. Your body has things naturally to help with aiding the healing process. Awesome. Now, how do you know when a wound is infected, Doc?
So ways to tell wound is infected are pain, redness, swelling, and sometimes they have a little discharge. So the white, green, yellow, any type of discharge, that wound is definitely infected.
Okay. So let's see, to be clean. I'm going to put that here. Sorry, I'm typing. I want people to not forget what we're talking about. They may have to go back and rewatch, but signs of an infection, swelling, pain, redness, and then in the discharge.
Yes.
And at that point, it's important for you to go see your doctor.
Yes.
And make sure that that's treated typically with antibiotics.
Yes.
What are some of the most interesting wound cases you've seen?
So I would say I did have a patient who we call it degloving. So the skin was completely off of his lower extremity, the lower part of his leg onto. So I was able to see his tendons, his muscles, everything. That was a wound, a very interesting wound. And then I had a patient who was diabetic. And her toes were they were black and showing signs of no life, and no circulation. And we were able to put her in our hyperbaric oxygen chamber. And what that does is you put in 100% oxygen, and it brings oxygen into your tissues and allows you to new blood vessels to allow those areas that are dead to live or come alive. And those were able to be salvaged. You did not have to have amputation. That was
wow. Wow. And I kind of want to, emphasize this again, especially for, for our viewers and for patients who are diabetic. Um, these things sound a little too distant, like, oh no, that can happen to me, or oh, my toe's turning black. So the science behind it is that, with diabetes, nerve is damaged, right? So you're not able to notice when something is happening with your feet, because most people don't look at their feet. They're very far from your eyes, right?
Right.
You barely look at it except when you're putting your shoes on. So little cuts under the soles of your feet, you're not seeing, you're not noticing it, because your nerves are not able to tell you, like, hey, something is wrong.
Yes.
And that is why it's very, very important for you to, have a primary care doctor going for your preventive
Yes.
visits to catch these things, to check these things before they become an issue. I've had patients lose their feet, lose some of their toes, and it affects the quality of life. So please, 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 of course, these are medical advice. You should, make appointments with your primary care doctor. Prevention is always better than cure. So
Yes.
this has been very, 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 very useful, and I'm glad that patients have options, even with complicated wounds, to see you.
Yes.
Um, so that being said, people are wondering, I like this Dr. Joya Sykes. I want to come talk, at an event, or I want to communicate with her, or I want to come see her. Doc, where can people find you?
So I am on Twitter. My Twitter handle is AKA AKAFAMDOC. And our wound care center number is 682-242-4325.
All right, awesome, awesome. What's going to happen is after this live, I'm going to put that information in the comments so people are able to connect with you. But thank you so much for being here. This has been very simple, very useful, very profound. So thank you so, so much.
Awesome.
All right.
Absolutely. Anytime.
All
Thank
right,
you.
awesome. All right, for those who are, you're welcome. For those who are watching live, I always forget to say this, hashtag live. Those who are watching replay, hashtag replay. Please share this with those who could find this useful. And if you or anyone you know is looking for an awesome and a thorough and a passionate family physician in the Mansfield, Texas area, I am she. Thank you.
All right. Bye-bye.